Good morning, students. Today we will be discussing Kuhs Community Medicine, Paper 1, February 2017 answer key discussion. Okay. Though in the screen there is no question, I will read the question. So the first question is a 10 marker essay. The district hospital reports a confirmed case of anthrax from one of the villages in your primary health center and you are instructed to investigate it. Answer the following. First up question, describe the steps you take for the investigation. 5 mark. How will you manage the case? 3 mark. What are the preventive measures? 2 mark. So the investigation of an epidemic, any epidemic, anthrax is an epidemic. So first we have to go for the verification of the diagnosis. That is the first step. Okay. Then confirmation of the presence of the existence of an epidemic. Defining the population at risk and the area mapping. Rapid search for all cases and their characteristics. Then we have to go for data analysis. Then we have to go for formulation of an hypothesis, testing of that hypothesis, evaluation of the ecological factors and the implementation of the control of the measures. Further investigation of population at risk and writing the report. So verification of the diagnosis, confirmation of the presence of the existence of an epidemic. You have to actually see yes, there is an epidemic. Then defining the population at risk and the area mapping, a rapid search for all cases and their characteristics. Then you go for the data analysis, then formulation of the hypothesis, testing of the hypothesis, evaluation of the ecological factors and implementation of the controlled measures, further investigation of the population at risk and writing the report. So how will you manage the case? It is anthrax. So serious case of anthrax have to be hospitalized, may require aggressive treatment, antibiotics. Cutaneous anthrax you have to go for oral doxycycline. Alternatively, any quinolone can be used for a total course of 7 to 14 days. With the doxycycline, a loading regimen should be used. 200 mg PO or IV every 12 hours for 72 hours. In severely ill patients, 200 mg IV or PO every 12 hours may be continued without toxicity for the duration of therapy. So doxycycline for cutaneous anthrax, oral doxycycline. Then inhalational anthrax and anthrax meningitis, then penicillin is preferred. For patients suspected to have systemic anthrax, antitoxin should be added to combination of antimicrobial drug treatment. Then Raxibacumab is a human Ig1 gamma monoclonal antibody directed at the protective antigen of the Bacillus anthracis. Then what are the preventive measures? Immunize high-risk patients like lab personnel, workers in industries handling infected raw materials and military personnel. Educate employees who handle potentially contaminated articles about modes of anthrax transmission, care of the skin abrasion and personal cleanliness. Control of dust and properly ventilate the work areas in hazardous industries. Continue medical supervision of employees. Provide prompt medical care for all suspicious skin lesions. Personal protective measures. Thoroughly wash or disinfect or sterilize the hair, wool, bone, meal of other feed of animal origin prior to processing. The preferred disposal technique is to be incinerate the carcasses at the site of death. Control the effluents and trade waste from factories that manufacture products from hair, wool, bones, hides likely to be contaminated. Promptly immunize annually, re-immunize all animals at risk. The second question is a problem-based 5-mark question. So please listen to the question properly. The warden of a hostel brings a child to you with scabies. What advice will you give to the warden in managing the case? Warden of a hostel bring a child with scabies. What advice will you give the warden in managing the case? So treatment direction, individuals to be treated should have warm shower or bath with soap and dry their body prior to treatment. Apply permethrin 5% for 8 hours or benzoyl benzoate 25% for 24 hours. Permethrin based medication should be applied in the evening and left overnight. Apply thoroughly to the entire body from the neck down. Insufficient coverage is the primary cause of the treatment failure. Then comes question number 3. The prevention. What you can do, the warden can do to prevent scabies in that hostel. blanket treatment. All close skin to skin contacts and other people in the same hostel and his household should be treated with same time, and even if no itching or other symptoms are present, both affected patient in the 72 hours prior to treatment should be laundered using hot water more than 50 degrees Celsius to kill the mites. Then the problem based third question in your question paper, said carefully. In a community health center, what steps should be taken by the healthcare workers to address adolescent health programs in the area? Community level. So in the community level, what you can do is that village health nutrition classes with the maximum participation of adolescent girls, ICDs, nutrition programs like Kishore Shakti Yojana nutrition program for the adolescent girls, iron and folic acid supplementation through Anganwadi and Asha workers, adolescent friendly health clinics with all facilities at taluk or district level, peer group formation and awareness regarding alcohol, tobacco and substance abuse at school level. Adolescent health awareness classes from high school regarding reproductive, sexual health, contraception, menstrual hygiene, nutrition, study problems, mental health problems, etc. School health JPHN as a link between adolescent children and health system and necessary reference. Maintaining health records of school children and ensuring annual checkup by the health staff. Rubella vaccination for adolescent girls, strengthening of the WIFs, weekly iron folic acid supplementation programs, WIFs, WIFS. Now next in your question is the short answer questions. First question, that is the fourth question, couple protection rate. Couple protection rate. So definition is this the percentage of the eligible couples effectively protected against childbirth by one or the other approved methods of family planning. FP means family plan, like sterilization can be there, IUDs, intrauterine devices, condoms, oral contraceptives. Any method they can use, but they should be protected against childbirth. Then indicator of the prevalence of contraceptive practice in community. NRR is equal to 1 will be achieved if CPR is more than 60%. Couple protection rate is more than 60%, then the NRR will be equal to 1. 60% eligible couples are still unprotected against consumption. The fifth question is another formal question, midday meal scheme, also known as the school lunch program in operation since 1961. Goals: reorientation of eating habits, incorporating nutrition education into curriculum, encouraging the use of local commodities, improving the school attendance and the educational performance of the children. The broad principles is the should be a supplement and not a substitute. Supply at least 1/3 of the total energy requirement and half protein requirement. Low cost, locally available food material should be used, should be easily prepared in schools. Menu frequently changed to avoid monotony. Model menu: cereals, millet 75 gram per day per child. Pulses should be 30 gram. Oil, fats 8 gram. Leafy vegetables 30 gram. Non-leafy vegetables another 30 gram. In this way, you make the midday meal scheme. It will be so cereals 75 gram per day per child. Pulses 30 gram. Oil, fats 8 gram. Leafy vegetables 30 gram. Non-leafy vegetables 30 gram. Then sixth question, another 4-mark question. Who is called at-risk infant? Who is the at-risk infant? It's a concept that they contribute largely to the perinatal, neonatal, and infant mortality. So special intensive care to be given by identify them early. Then who are the at-risk infant? Because their birth weight will be less than 2.5 kg. Then artificial feeding should be initiated. If the weight is less than 70% of the expected weight, secondary or tertiary malnutrition, birth order 5 or more, twins, children with protein energy malnutrition, diarrhea, then failure to gain weight during 3 successive months, working mother, single parent, like that, they are all the at-risk infants. Another 4-mark question, effects of the noise pollution. Auditory effects, auditory fatigue. Non-auditory effects, interference with the speech, then deafness, then annoyance, decreased work efficiency, physiological changes. The question is 4 mark. What is lead poisoning? Sources. Occupational, industrial handling, battery, glass, ship, printing, rubber pottery. Non-occupational means gasoline, lead pipes, lead paint, toys, etc. Mode of exposure, inhalation, ingestion or skin contact. Toxic level more than 70 microgram per deciliter. Clinical picture, inorganic lead poisoning. There will be abdominal colic, constipation, loss of appetite, blue line on the gums, stippling of RBC, anemia, wrist drop, foot drop. Organic lead poisoning, there will be insomnia, headache, mental confusion and delirium. Diagnosis through history and clinical features. Lab test, urine coproporphyrin in less than 150 microgram per liter and aminolevulinic acid in urine more than 5 microgram per liter, lead in blood and urine. Peripheral blood smear, basophilic stippling of the RBC. Preventive measures, substitution, isolation, local exhaust ventilation, personal hygiene, personal protection, good housekeeping, periodic examination of the workers and personal hygiene. Management, prevention of further absorption, saline purge, D-penicillamine. The difference between questions, 2 mark questions. So pre-placement examination and periodic examination. Pre-placement examination done at the time of employment, usually one-time examination, thorough physical examination and battery and of biological and radiological examination with the history, usually done to determine the fitness for job. Periodic examination done after joining the occupation. Frequency depend on occupational exposure. Examination targeted at the type of exposure and possible adverse events. Screening for occupational diseases is our aim. Next question, differentiate between demand feeding and exclusive breastfeeding. Exclusive breastfeeding concept is baby needs only breast milk during first 6 months of life. Breast milk is superior to all other baby feeds and is best for the baby. It arises from observation that exclusive breastfeeding has many advantages for both mother and baby, and additional baby feeds may hamper mother's milk production and the dangers of contamination and over dilution of the feeds. Demand feeding means concept responding flexibly to baby's hunger cues. It tells that it is not desirable to train baby round the clock feeding. It arises from the observation that baby's demand may vary according to baby's size, strength of suckling and mother's milk supply. So what is the difference between source and reservoir? Source means that from which infectious agent passes to disseminate to host. That is the place from which infectious agent passes to the host. Infectious agent does not depend on source for survival. Infectious agent does not reproduce in the source. Example, saliva of rabid animals in rabies, urine of infected rodents in leptospirosis. Reservoir means that on which infectious agent lives and multiplies. Reservoir means the infectious agent lives there and multiplies there. Then only we can say that is the reservoir. But a source means the infectious agent just passes or disseminates to the host. It depends primarily for survival. Infectious agent reproduces and transmits to susceptible host. It is the soil in tetanus and rats and small rodents in leptospirosis. Then substantiate your answer with reason. The 12th question, what is herd immunity in tetanus? Herd immunity does not protect the individual in tetanus as there is no person-to-person transmission in tetanus. Then next question, substantiate your answer with reason. 2 mark question. Vitamin A supplement is given to a child recovering from measles. Serum concentration of vitamin A is decreased in measles due to depletion of hepatic stores and inadequate mobilization of the vitamin. Combined effect of measles and vitamin A deficiency destroys the epithelial function and depresses the immune function. So vitamin A supplementation in measles restores the low vitamin A levels during measles that occur even in well-nourished children, and it reduces the morbidity and the mortality. Next question, list the following, 2 mark each. Benefits under ESI Act, Employee State Insurance Act. Benefits to employees, medical benefit is there, sickness benefit, maternity benefit, disablement benefit, dependence benefit, funeral expenses and rehabilitation allowance. Benefits to the employers, exemption from applicable Workmen's Compensation Act 1920, the exception from Workmen's Compensation Act, exemption from Maternity Benefit Act, exemption from payment of medical allowance to employees and dependents, rebate under the income tax on contribution deposited in the ESI account, healthy workforce. 16th question, list the following vectors of malaria and their breeding places. There are 45 species of anomalies, out of which few vectors of primary importance. Breeding habit in general is clean water. For vectors of malaria, breed in clean water. Malaria breed in clean water. So, Anopheles culicaceus. The breeding places pools, pits of clean water. Anopheles fluviatilis, moving water. Anopheles stephensii, wells. Anopheles sudaicus, brackish water. Then 16 indicators used in computing Kuhs scale. Education, occupation, family income per month. Education, occupation, family income per month. Steps in case control study. So selection of cases, selection of control. Matching, measurement of exposure, analysis and interpretation. List the following two advantages and disadvantages of nuclear. Advantages: husband-wife relation more intimate, minimal problems of overcrowding, greater burden on family and responsibility of childbearing, less economic and social security. Okay, thank you. Have a nice day. Next question we will discuss in next video.